This is going to be a somewhat brief but deep video about political science. I think that the whole sphere of politics is really still being haunted by this question of centralization and decentralization. And it's haunted by it partly because it was a major point of political contention about 20 years ago. But it remained in this strange gray area where it was never really examined properly by economics as a discipline, like as a discipline alone. And it's also never really handled by politics as a discipline. It's in this dangerous gray area where it's partly within the domain of economics, but the economists don't really want to think seriously about the political and ethical aspects. And then it's partly in the domain of politics, where everyone is inclined to lie in their self-interest. So in the discussions about Bernie Sanders and his proposed transformation of the American healthcare system, one of the questions being asked is, could Bernie Sanders really achieve a dramatically more efficient system in America through the reforms he's proposing? Could he achieve greater efficiency through any method other than lowering the salaries of doctors and nurses? Now just pause. Efficiency is not the only consideration here, right? Efficiency is one consideration. Fairness is another consideration. If you wanted to take the position that, you know what, it's okay if the American healthcare system becomes less efficient, like it can cost more money and so on, if poor people are really able to have equal access to cancer treatment along with rich people, that morally that's an objective so important that that's going to justify some inefficiency. So very often in politics, efficiency is not the most important thing. Poor people in rural areas, do they have access to the same quality of education as rich people in major cities? If you want to provide that, you're going to have to embrace a certain level of inefficiency. And that's okay. You can decide democratically even that that's good, that something else is your priority other than efficiency. However, politically, right now, Bernie Sanders is encouraging Americans to imagine that through the centralization of medical services, of medical administration, and of health insurance, which sort of exists as a shadow of the medical system. I mean, you could say he wants to eliminate the health insurance industry, or you could say he wants to centralize health insurance. You can express it in different ways. But basically, through centralization, trillions of dollars will be saved in greater efficiency. Now, again, one really brief thing I need to pause to clarify. In my earlier video, I showed you on screen just how astronomical the average wages for American doctors were, primary care doctors, and also specialists. In Germany right now, the average salary for a nurse is $38,600. These are US dollars. Germany is not a third world country. Germany is not providing medicine at third world standards. Germany is an affluent first world country with, generally, people consider it to have excellent healthcare, or at least very good healthcare. The nurses are being paid $38,600 in average salary. Okay? In the United States of America, the equivalent average is $73,500. So nurses making $73,500. Now, I think that average is kind of low. If you break it down category by category, you get much, much higher numbers. So, if you look at, the term nurse covers a wide range of things. Are you looking at registered nurses? Are you looking at nurse practitioners? And the different states have different, within the United States, different regions have different definitions. So it's a little bit complex. However, a nurse in California is likely to make over $100,000 US dollars. I have one friend who is a nurse in California. He says everyone is making $100,000 or $150,000 and up as a nurse out there. Again, his definition of nurse, I think he's not including the less qualified nurses who just work in retirement homes. So it's a little bit complicated. Nevertheless, My point is here, the most obvious way the United States of America could achieve greater efficiency in healthcare would be dramatically reducing the salaries being paid to doctors and nurses. So as soon as Bernie Sanders creates this federal government system of providing healthcare, there will be the temptation for whoever is in charge of the government to save money by providing doctors and nurses with a salary that is similar to the salaries paid in France, paid in Germany, paid in countries other than the United States of America, right? And of course, the same question is also being asked about pharmaceuticals, drugs. Why should Americans pay more than people pay for the same drugs in other countries? Well, the question deserves to be asked, why should they pay more for doctors and nurses for the labor that they do in other countries? And that's going to have profound political implications. So the ghost haunting mainstream political discourse here is the question of what advantage is to be gained from centralization itself. And I think the best example I can give you here is imagine the beer industry, all right? Let's imagine the beer industry in a medium-sized country like Japan. And throughout Japan, there are little craft breweries, okay? So there are little small privately owned businesses scattered around. And then let's say there are also sort of medium-sized factories throughout Japan producing beer for this whole population. Let's say someone decides to run for government with the promise, if they are elected, they will reorganize the beer industry to be centralized and achieve greater efficiency. They're looking at the beer industry and say, look, there's this whole mess of little local privately owned companies doing this. And beer is much too expensive. The whole process is much too inefficient. Fundamentally, a bottle of beer should be just as cheap as buying a bottle of soda pop or a bottle of water. Let's centralize this whole industry into just a few enormous, highly efficient factories, and then the price of beer will drop dramatically. There will be greater efficiency achieved through economies of scale, through centralization itself. Now, I'm using this example because I think it's very easy in this case for people to imagine, step by step, to think through what are the advantages of centralization and what are the advantages of decentralization. And why is it that in most countries that drink beer, like Germany or like the United States, you actually have a mixture of centralized and decentralized beer production, right? So there are smaller companies that generally charge a higher price that produce beer locally and that will generally have more variety and more innovation. Now, again, it's important to keep in mind here, there's a sense in which beer hasn't changed in 1,000 years, right? And yet, if you're someone who cares about beer, I'm not, I don't drink alcohol, but advertising surrounds me. I'm aware that small craft breweries are coming up with new ways to make beer and new flavors of beer and new ideas. They're innovating and responding to local interests. They're producing new products and finding new markets and so on all the time. On a tiny scale, there are these craft breweries taking these kinds of risks. Also, of course, craft breweries, they don't have to transport their goods over such a huge distance, right? They may have a local clientele and they can produce for that, so on and so forth. Whereas if you have one huge factory in one location, then you need an army of truck drivers to distribute the beer. And beer goes bad. The passage of time matters for beer. It doesn't go bad as rapidly as something like baked bread or something, but nevertheless, how you transport beer, the temperature you keep it at, and the passage of time, those things all matter too. So what you normally end up with under free market conditions, so to speak, is not the dominance of the centralized mass manufacturing model, but you have both in competition with each other, and each has its own advantages and disadvantages. However, let's go back to Japan and say we have this political party that's promising you they will dramatically reduce the cost of beer by centralizing it into one system, one public sector system, the same way Bernie Sanders wants to centralize medical care. All right, what would be the savings? Fundamentally, bottle by bottle and liter by liter, if you're going to provide the same number of millions of people with beer, you're going to be facing the same costs whether you manufacture that beer on a large scale or a small scale, right? In a centralized manner or in a decentralized manner. If what you want to do is provide medical services, which, again, for the most part, this is doctors consulting face-to-face with people who have the flu and taking their temperature and taking stool samples and doing medical tests and giving them advice and giving them prescriptions, this kind of thing again and again. That face-to-face interaction with the doctor taking your temperature and checking your blood pressure, these kinds of routine things, there isn't some kind of dramatic increase in efficiency by having an enormous hospital centralized in one location, and centralized administratively under one government's control, or one giant corporation's control for that matter, doesn't matter, as opposed to many small competing locally owned hospitals, doctors' offices, for-profit medical services, so on and so forth. There isn't any self-evident savings in efficiency there, right? Now, again, in a sense, with brewing beer and putting beer into bottles, even though I'm sure there is some savings in terms of having larger and more efficient equipment, you could say that about hospitals too. At a hospital, the way people share equipment, the way people perform medical tests and so on, as opposed to a small doctor's office needing to send the stool sample to a lab to have the test done and have it sent back, there are going to be some savings there. But liter for liter, in terms of the ingredients that go into beer, and pound for pound, what have you, there isn't some kind of obvious dramatic savings when you centralize as opposed to having decentralized services. Except the cost of labor. When you centralize the manufacturing of beer into one giant factory, you get anonymous, faceless factory employees, right? And then the corporation can pay these people minimum wage, they can pay them almost nothing, and they can replace them very easily and say, hey, you don't matter to us. The small, locally owned brewery is very likely to be kind of one guy who started the business and his wife, maybe his wife and his son, and maybe they have 2 employees. They are almost inevitably going to pay themselves higher wages. The business really exists for them. They don't regard themselves as nameless, faceless, easily replaceable employees, right? The centralization of medical services and the centralization of factory production, it's partly just a kind of change in social perspective that comes about with central planning and the pursuit of greater efficiency. It almost always connects to paying lower wages, right? And again, if you imagine yourself in the position of the President of the United States of America, you would then be asking yourself, why would you pay doctors and nurses in the United States so much more than they're being paid in France or Germany? And you have a responsibility as the President of the United States to use taxpayers' money responsibly, so on and so forth, right? You're not administering this centralized bureaucracy for the benefit of the doctors or the nurses, right? So, likewise, again, if you were the government in Japan and they take over the beer industry and centralize the beer industry, they're then looking at that from this centralized authoritarian perspective and saying, well, our job is to produce a large quantity of beer at the lowest prices possible. Why should we pay these people more? We can pay them minimum wage. It's the same as any other factory job, and that's it. And what you lose is the small amount of innovation that comes about with the locally owned small craft beer factory. Again, I'm not glorifying this, but there's some guy who sits around and says, okay, let's come up with a new beer for this summer or for this winter, and they design a new label and they come up with a new gimmick. I remember there was a beer company in Canada that decided they were gonna have coffee flavored beer. And this was gonna be the new thing, and that kind of innovation probably fails 9 times out of 10. I don't know, they come up with new ideas, but the people are being paid more. I'm not even presuming these are tremendously brilliant and innovative people, but they do sit around trying to innovate, trying to make the most out of their little local brewery. And the hope is, the dream is, that with decentralization, you're going to get more innovation of one kind or another. Now, again, I'm using both examples here because I'm not wildly optimistic about that. I don't think it's the case that a decentralized medical system results in you having amazing new innovations in how doctors treat heart attacks. It may well result in a better kind of quality of service for people. I've seen that in contrasting the Canadian healthcare system to the American healthcare system. I'm amazed at how good the human relations are, the service element of the American healthcare system is, because what I'm used to is the socialist system in Canada. So just in the last couple of years, because I have an American girlfriend, I've been back and forth across that board. I'm really surprised at how well the American healthcare system works on that side. But that's just sort of how it caters to the individual client, which I guess you can say is what's happening in the beer industry also. That doesn't represent greater efficiency, and it doesn't in and of itself represent a kind of greater quality of service, if by quality you mean the real health outcomes, like actually saving people's lives or actually performing a better quality of heart surgery or whatever metric you want to use to measure that. Okay, so I think the whole political spectrum, left and right, remains a bit mystified about the advantages and disadvantages that are linked to centralization and decentralization. People, I think, are naturally afraid of centralization because it is opaque. It lacks transparency. It lacks public accountability. However, the fundamental advantage of centralization is fairness. If you centralize the education system, then there's really the potential to provide equal education for all, uniform standards for all, just even that we write the same exam and we're graded the same way, where I feel, okay, I can compete with you and I know I'm writing the same exam you're writing. We have the same opportunity, we're graded against the same scale. Fairness is a huge fundamental advantage that means centralization is the way to go with some types of services, some types of social functions. However, yes, decentralization gives you a more responsive, more kind of adaptive and adaptable, more innovative, more transparent in the sense that local people, more transparent system in the sense that local people get to go and scrutinize that doctor's office or that local beer factory, and they have a choice. They say, okay, I don't like this doctor's office. It looks dirty or it looks poorly organized. I don't like this craft brewery, so I'm going to choose to go to another place. The more centralization you have, by definition, the less choice you have. So that highly centralized education system, you can't switch schools, or even if you do switch schools, the other school you switch to is exactly the same as the school you left, because ideally it's a totally centralized, totally uniform system. All of the options are scary. All of the consequences are intimidating. But in the year 2020, the United States finds itself in such a dire position in terms of the provision of healthcare to its people that they're certainly not risk averse. The time has come for the United States of America to try something new. I hope they'll engage in a really sincere comparative study of what the different strategies used around the world are. In Europe, in Japan, here in Taiwan, and that they're going to make a wise choice that isn't just guided by abstract ideology, but is guided by a nuanced awareness of the advantages and disadvantages of socially provided healthcare as it has been tried and tested in other countries around the world.